So let's talk about the traditional treatments. I mentioned all of those things that many of my patients have tried and they've had minimal results with them. Non-steroidal anti-inflammatories, either over the counter, even the natural ones, the quercetin, curcumin, boswellia, all of these usually only have minimal results. The braces, they do definitely help. I often recommend them in conjunction with the treatment, but they don't seem to get people over the finish line. They don't seem to take people all the way to full recovery. Cortisone injections are sometimes used for this. This does weaken the tendon long term, especially at a certain dose. So it can get you out of pain, but it doesn't seem like the best long-term solution because causing some damage. Physical therapy, your physical therapy is only as good as the provider who's providing that physical therapy. And so some physical therapists can get some pretty good results with this, but most people have had limited success with physical therapy. It hasn't really, it may have helped, but it hasn't really resolved the problem. And then, some people even go and get surgery for this, especially if they've identified something through the MRI or the diagnostic ultrasound that's wrong in that area, then they go ahead and get surgery. And that has its own set and list of complications and may not actually solve the situation.